Why hasn't an oral diabetes tablet become more widely used in the UK? Rybelsus hasn't achieved widespread adoption in UK clinical practice due to complex dosing requirements, higher cost, NHS formulary restrictions, and competition from alternatives with simpler administration and proven cardiovascular benefits. Before we start, a quick note. This video is general information for UK adults with type 2 diabetes and is not medical advice. Always speak to your GP or diabetes team about your own treatment. Rybelsus was actually a really exciting development when it came out. It's the first GLP-1 medication for type 2 diabetes that you can take as a tablet rather than an injection. So you think it would be incredibly popular. But in reality, it hasn't been widely adopted in the UK, and there are some very practical reasons why. Let's start with what Rybelsus actually is. It's semaglutide in tablet form, the same active ingredient that's in Ozempic, but you swallow it instead of injecting it. It works by mimicking a natural hormone called GLP-1. This helps your pancreas release insulin when your blood sugar rises, reduces a hormone that raises blood sugar, slows down how quickly your stomach empties, and helps you feel fuller. Research shows it can reduce HbA1c, which is your long-term blood sugar measure. So far, so good. But here's where the challenges begin. The dosing requirements for Rybelsus are quite strict. It must be taken exactly as directed in the patient leaflet, under very specific time-sensitive conditions that some people find difficult to follow consistently. If you don't follow these instructions precisely, the medication won't be absorbed properly. And absorption is already an issue. Rybelsus has very low bioavailability, meaning only a tiny fraction of the dose actually gets into your bloodstream, between 0.4 and 1% in fact. If you're prescribed Rybelsus, follow your prescriber's or pharmacist's instructions carefully on timing and how to take it. Compare this to injectable GLP-1 medications. They're absorbed much more efficiently, and many only need to be taken once a week. Yes, they involve an injection, but for some people, a weekly injection is actually simpler than remembering strict daily requirements. Then there's the cost factor. Rybelsus is significantly more expensive than many established diabetes treatments. Metformin, which is usually the first medication people try for type 2 diabetes, costs a fraction of the price. SGLT2 inhibitors, another class of diabetes medication, are also more cost-effective. The NHS has to consider value for money, and this affects which medications are prioritised. Though it's worth noting that local formulary policies vary across the UK. NICE guidance positions GLP-1 receptor agonists as second-line treatment or later. That means they're not usually the first option, and many NHS areas have gone further, restricting Rybelsus to third-line therapy specifically. Some local formularies require specialist initiation or detailed justification before a GP can prescribe it. This creates administrative burden compared to other options that don't have these restrictions. There's also strong competition from other medication classes. SGLT2 inhibitors have proven cardiovascular and kidney protection benefits. Injectable GLP-1 receptor agonists have robust cardiovascular outcomes data as well. These proven benefits in protecting the heart and kidneys matter enormously when you're managing type 2 diabetes long term. So what does this mean if you're considering treatment options? The most important thing is to have an open conversation with your healthcare professional. They can explain which medications are available to you based on your individual circumstances, other health conditions you might have, and what your local NHS area recommends. If you're already taking Rybelsus and it's working well for you, that's great. But if you're finding the dosing requirements difficult to manage, or if you're wondering why you haven't been offered it, these are all things worth discussing. You should also talk to your doctor if you're experiencing any side effects, if your blood sugar control isn't where it needs to be, or if you're struggling with the practical aspects of taking any diabetes medication. There are multiple treatment options available, and what works best varies from person to person. When should you seek medical help? Contact your healthcare professional if you're having persistent side effects. if you're not sure you're taking your medication correctly, or if your blood sugar levels are concerning you. Never adjust your prescribed dose without medical guidance. So, to recap, Rybelsus is an innovative oral GLP-1 medication, but it requires strict administration conditions that many find inconvenient. It costs more than established alternatives and faces NHS restrictions in many areas. And it's competing with medications that have simpler dosing and proven heart and kidney benefits. These factors together explain why it's not as widely used as you might expect. Your diabetes treatment should work for your life and your health needs. Always speak to your healthcare professional about what's right for you. If you found this helpful, let me know in the comments what other medication questions you'd like answered. And don't forget to like and subscribe for more evidence-based health information from Bolt Pharmacy.